So my advice to physicians and other caregivers treating for elderly patients is to treat them like whole people, not necessarily seeing them as in terms of their age, but seeing age as one factor among many that's part of aggregate risk. So in this study, they looked at patients that were in their 70s and showed that there was mortality benefit as well as morbidity benefits of treating with statins. So the average length of life is about 80, which means that people, even in their 70s, do care about their longevity and years that they can gain by statin therapy. But even more important, perhaps, is the fact that patients will benefit with reduced strokes, reduced claudication, and other endpoints that are highly relevant for their lives and well-being despite advanced age. So studies like this are very important in terms of cardiovascular prevention in older adults. One, because it shows the efficacy that's so strong. Dr. Waters' editorial points out that this type of efficacy was expected, but it really hasn't been well demarcated in relation to age. And even more important is that this study shows efficacy of statins in their 70s, and the average length of life in America is 80, so that many people live well beyond the population studied in this particular investigation. So we need much more data to look at the effects of statins into the 80s and 90s and even beyond. We need to be clear about the dosing and about the potential for iatrogenic effects in relation to the complexity of patients that have predisposition to multimorbidity and polypharmacy. So again, to highlight that this is a very important study in showing mortality benefit as well as morbidity of stroke and heart attack in patients in their 70s or mean age about in their 70s. But to emphasize that the utility of statin therapy goes well beyond the endpoints looked at in this study in relation to aging, issues of claudication, issues of atrial fibrillation, issues of even functional benefit are all types of endpoints that can be achieved by statin therapy. So as we think about use of medications in older adults, we really have to broaden our perspective of endpoints and consider the enormous value or potential value of statin-like therapy. And then we have to really better measure the trade-offs in terms of myalgias, in terms of other complexities that may be disproportionate in relation to age. So we need much more data, but with the presumption that there may be enormous utility for this kind of medication. Thank you.